Lots of Canadians know someone with prostate cancer. That's no surprise because prostate cancer is the most commonly diagnosed cancer among Canadian men. It's important to understand the disease so that you can make the best decisions for you and your loved ones. Let's start with the basics. You've probably heard about the prostate, but do you know what it does? About the size of a walnut, the prostate is part of the male reproductive system, located in front of the rectum just below the bladder. Its job is to provide nutrients and fluid to sperm. Anyone with a prostate can get prostate cancer. Like other cancers, it happens when cells grow faster or die more slowly than they should, eventually forming a tumor. Some people have a type of prostate cancer that grows so slowly it won't ever cause problems or shorten their life. They might not need treatment and instead can be safely monitored to make sure the cancer doesn't grow or spread. Other types of prostate cancer grow quickly and spread outside the prostate to other parts of the body, like the bones or lungs. This type is called metastatic cancer. It's life-threatening and needs to be treated as early as possible to prevent any further growth or spread. We're still trying to find out what causes prostate cancer. While we don't have all the answers, we do know some things can increase the chances of getting it. The risk of developing prostate cancer increases with age. Most of the time, it happens after age 50. We don't know why just yet, but Black men have an increased risk of developing prostate cancer. Those who have prostate cancer in their family, especially if their father or brother had it, are at higher risk. People with inherited mutations in certain genes like BRCA2, also known as BRCA2, or who have a family history of breast or ovarian cancer, may also be at higher risk. But the bottom line is that anyone with a prostate can develop prostate cancer, with or without these risk factors. There are often no symptoms of prostate cancer, especially in its early stages. As the cancer grows, some people may have problems peeing, experience painful ejaculation, or find blood in the pee or semen. If cancer spreads outside the prostate, symptoms can include bone pain, weight loss, and kidney problems. It's important to remember that when prostate cancer is caught early, 5-year survival is close to 100%. Unfortunately, if prostate cancer is diagnosed when it's more advanced and has spread to other parts of the body, only about 1 in 4 men will survive. That's why catching the disease early is so important. The good news is that there are simple tests that can help detect prostate cancer early, even without symptoms. A blood test called the prostate-specific antigen, or PSA test, is a key step in detecting prostate cancer early. PSA is a protein that is made by the prostate and it shows up in the blood. It's normal to have low PSA levels, but higher numbers are a sign there may be a problem with the prostate, potentially cancer. You should discuss the PSA test with your doctor when you turn 50, or at 45 if you're at higher risk. The other test that's important to early detection of prostate cancer is called a digital rectal exam, or DRE. You may know it as the finger exam, a test where a doctor checks the size and shape of the prostate and feels for any lumps or abnormal areas by inserting a finger into the rectum. Some people may worry about having a DRE, but you should know that the test only takes a few minutes, and while it can be uncomfortable, it usually isn't painful. Using these tests together is better than using either test alone. If the PSA test and DRE suggest there might be prostate cancer, your doctor may recommend a follow-up PSA test or other tests. You may be referred to a urologist. The only way to know that it's prostate cancer is with a biopsy, a procedure where a needle takes small tissue samples to look for cancer cells. Imaging tests like MRI, CT scan, or bone scan may also be used to see where the cancer is and if it has spread. If you're diagnosed with prostate cancer, your doctor will use the results from these and other tests to find out if it's growing slowly or more quickly. Using all this information, they may recommend monitoring the cancer if it's the slow-growing type, or suggest a treatment plan that's right for you. And now, in only a few minutes, look how much you've learned about prostate cancer. We continue to discover more and better ways to diagnose and treat the disease. Because of better education, awareness, early detection, and treatments, the death rate has been cut in half since the early 1990s. There's still a lot more that we need to learn about the disease. It's why we continue to fund research to take control of cancer. We want a future where hearing that someone has been diagnosed with prostate cancer isn't so scary, and a future where no one loses a father, brother, son, or friend to this disease. So, what should you do next? If you have a prostate, speak to your doctor about your prostate health and early detection. Spread the message about the importance of early detection. It could save someone's life. And make sure to continue educating yourself. The Canadian Cancer Society can help. Visit cancer.ca or call 1-888-939-3333.